السلام علیکم ورحمۃ اللہ وبرکاتہ. تو آج ہم سورہ کاف کی آیت نمبر 53 اور 54 کو دیکھیں گے. اعوذ باللہ من الشیطان الرجیم. بسم اللہ الرحمن الرحیم. ورأى المجرمون النار فظنوا انہم مواقعها ولم يجدوا عنها مصرفا. And the guilty shall behold the fire and know that they are bound to fall into it and will find no escape from it. اور مجرم لوگ آتش دوزخ کو دیکھیں گے تو جان لیں گے کہ وہ یقیناً اسی میں گرنے والے ہیں اور وہ اس سے گریز کی کوئی جگہ نہ پا سکیں گے. ناؤ آیت نمبر 54. وَلَقَدْ صَرَّفْنَا فِي هَذَا الْقُرْآنِ لِلنَّاسِ مِنْ كُلِّ مَثَلٍ وَكَانَ الْإِنسَانُ أَكْثَرَ شَيْءٍ جَدَلًا. And surely we have explained matters to people in Quran in diverse ways, using all manners of parables. But man is exceedingly contentious. اور بے شک ہم نے اس قرآن میں لوگوں کے لیے ہر طرح کی مثال کو انداز بدل بدل کر بار بار بیان کیا ہے، اور انسان جھگڑنے میں ہر چیز سے بڑھ کر ہے. Now moving toward the hadith that I have selected. کھانے کے معاملے میں حضور اکرم صلی اللہ علیہ وآلہ وسلم کی شان بندگی. حدیث پڑھ رہا ہوں میں. عن ابی جحیفہ قال قال النبی لا کلوا متکیا. صحیح بخاری سے لی گئی ہے حدیث. اس ترجمہ اس کا یہ ہے کہ حضرت ابو جحیفہ رضی اللہ عنہ سے روایت ہے کہ رسول اکرم صلی اللہ علیہ وآلہ وسلم نے فرمایا، میں ٹیک لگا کر یا کسی چیز کے سہارے بیٹھ کر کھانا نہیں کھاتا. تشریح اس کی ہے کہ ٹیک لگا کر یا بلا ضرورت کسی چیز کا سہارا لے کر کھانا کھانے کے لیے بیٹھنا متکبرانہ طریقہ ہے. حدیث پاک کا مطلب یہی ہے کہ متکبرین کی طرح تکیہ وغیرہ لا کر کھانا نہیں کھاتا اور اس کو پسند نہیں کرتا. میں اللہ کا بندہ ہوں اور کھانا بھی اسی طرح کھاتا ہوں جس طرح ایک بندے کو کھانا چاہیے. Now moving towards our presentation. ہمارا ٹاپک تھا presentation کا renal functioning test. Why test renal function? To assess the function capacity of kidney, early detection of possible renal impairment, severity and progression of the impairment, monitor response to the treatment, monitor the safe and effective use of drugs which are excreted in urine. When should we assess renal function? Older age, family history of CKD, decreased renal mass, low birth weight, diabetes mellitus, hypertension, autoimmune disease, systemic infection, urinary tract infection, nephrolithiasis and obstruction to lower urinary tract. What to examine? Renal function tests are divided into following: urine analysis, blood examination, glomerular filtration test, tubular function test. Kidneys and its role. The kidney are two bean-shaped organs located in the back of the abdomen on either side of the spine. They perform several essential functions that are critical to maintaining overall health. Regulation of fluid balance. The kidney help regulate the balance of fluid and electrolytes in the body. They filter excess water and waste product from the blood and excrete them in urine, while also retaining essential electrolytes like sodium, potassium, and calcium. Removal of waste products. The kidney filter waste products from the blood such as urea, creatinine, and other toxins and excrete them in urine. These waste products are produced by the body's metabolic processes and need to be eliminated to maintain healthy body function. Regulation of blood pressure. The kidney produce a hormone called renin which help regulate blood pressure. Renin stimulates the production of another hormone called angiotensin which constricts blood vessel and raises blood pressure. The kidneys also regulate blood pressure by regulating the balance of fluid and electrolytes in the body. Production of red blood cells. The kidneys produce a hormone called erythropoietin which stimulates the bone marrow to produce red blood cells. Red blood cells carry oxygen throughout the body and low level of erythropoietin can lead to anemia. Regulation of acid-base balance. The kidneys help maintain a proper balance of acids and bases in the body. They filter excess acid from the blood and excrete them in urine, while retaining essential bicarbonate ions to maintain a healthy pH balance. Overall, kidneys play a critical role in maintaining overall health by regulating fluid electrolyte balance, removing waste product, regulating blood pressure, producing red blood cell, and regulating acid-base balance. Any dysfunction of the kidney can have serious consequences for overall health and well-being. Signs and symptoms. When there is a problem with the kidney, it can lead to variety of signs and symptoms including changes in urine output, swelling, fatigue, shortness of breath, high blood pressure, nausea and vomiting, back pain, metallic taste in mouth, itching, difficulty concentrating. Now moving towards the main headings of our topic, which are the renal function test. Renal function test is a medical examination that assesses the functioning of the kidneys. The test measures the level of various substances in the blood and urine that are related to kidney function. Most common of the renal function tests are blood urea nitrogen test, creatinine test, and glomerular filtration rate. Urinalysis, the test we have performed in our lab. It examines the urine for the presence of blood, protein, glucose, and other substances that may indicate kidney damage or disease. Blood urea nitrogen test. The BUN test measures the amount of urea nitrogen in the blood. Urea nitrogen is a waste product that is produced when the liver breaks down protein, and it is normally eliminated from the body through urine when the kidney are not functioning properly. The level of urea nitrogen in the blood can rise, indicating kidney dysfunction. High level of BUN can also indicate dehydration, bleeding in the digestive tract, or a high protein diet. Creatinine test. The creatinine test measures the level of creatinine in the blood. Creatinine is a waste product produced by the muscles as they use energy. The kidneys normally eliminate creatinine from the body through urine, so a high level of creatinine in the blood can indicate that the kidneys are not functioning properly. The creatinine test is more specific for kidney function than the BUN test because it is not affected by other factors like dehydration or diet. Glomerular filtration rate. The GFR is a calculation that estimates how well the kidneys are filtering waste product from the blood. It is calculated based on the level of creatinine in the blood, age, gender, and race. The GFR is a more accurate indicator of kidney function than the BUN or creatinine test alone because it takes into account the individual age and other factors. A GFR of less than 60 ml per minute per 1.73 meter square for 2 to 3 months indicate chronic kidney disease. Urinalysis is an examination of the urine for the presence of various substances including protein, glucose, blood cell, and other substances that may indicate kidney or disease or damage. The test can help identify conditions such as urinary tract infection, kidney stone, and kidney damage from drugs or toxin. Proteinuria. The presence of excess protein in the urine is a sign of kidney damage as healthy kidney usually filter out protein from the blood. Overall, these renal function tests are useful in diagnosing and monitoring various kind kidney conditions such as chronic kidney disease, acute kidney injury, and kidney damage from the other medical condition or medication. One new method is included in presentation. The Bloom kidney test is intended to be used by medical professionals such as doctor and pharmacists to rapidly measure and quantify kidney function in user 18-year-old and above. A single-use semi-automated testing kit for the quantitative measurement of cystatin C in the bloodstream to estimate the glomerular filtration rate, which indicate how well one's kidney are working. Assalamu alaikum.